Hi, I'm Dr. V, and today I'm going to be talking about PCOS. PCOS stands for Polycystic Ovarian Syndrome, and it is the most common endocrine disorder among reproductive aged women. It's also the most common cause of anovulatory infertility, and it's characterized by excess androgens, aka male hormones, ovulatory dysfunction, and polycystic ovaries, or cysts on the ovaries. The classic triad of symptoms for PCOS include hirsutism, which is the excess growth of dark, coarse hair in places like the chin and chest, acne, and irregular cycles, mainly absent periods or very long cycles. And unfortunately, PCOS goes undiagnosed in many women, but some clues that you might have it include having had menstrual problems since your first period, having to be on birth control as a way to decrease signs and symptoms, having recurrent miscarriages, and having a family history of PCOS or infertility. And PCOS is commonly associated with insulin resistance and obesity, although not every woman with PCOS is overweight. PCOS is a complex disorder, and there are several different components, including hormonal, metabolic, and inflammatory components. There's no one way to diagnose PCOS, there's no one way to treat it, and there's no one way it presents. Everybody with PCOS is going to look differently, and they're going to need to be treated differently. The exact causes of PCOS are not yet fully understood, but like many other disorders, we know that it's a combination of genetic predisposition and environmental triggers. We do know that the development of PCOS is heavily influenced by nutrition and lifestyle factors. As far as treatment for PCOS goes, it's really important that you work with a primary care provider if you have PCOS or if you suspect PCOS in order to manage symptoms that can be severe or to decrease the risk of serious complications, including type 2 diabetes, heart disease, mood disorders, infertility, and even endometrial cancer. So the conventional approach typically involves the use of one or more of the following medications: oral contraceptive pills as a means to suppress cyclical hormones and therefore suppress symptoms, metformin as a means to decrease insulin resistance and support weight loss, and then clomiphene as a way to induce ovulation and promote fertility. And while these interventions are definitely necessary in certain situations, through a naturopathic lens, we're also looking at each individual person and their unique imbalances and targeting those with least invasive interventions we can, involving nutrition, lifestyle, and natural therapeutics like herbal therapy. We tend to focus on blood sugar management, decreasing exposure to endocrine disrupting chemicals, supporting gut and liver health, and optimizing nutrient status.